Hey everyone, I'm Jo Ridgway, a health educator, and today I'm here with Paige Ray, who is a dietitian at Colac Area Health. And we're here today to talk to you about all things women's health, just in particular to celebrate Women's Health Week. Yay, women. And Paige is going to share with you a special message about something, really dear to both of our hearts as women, but also as many people have their own struggles with. So she's going to talk to you about hormones. So over to you, Paige.
Hi everyone. So today I'm going to be talking about women's health and hormones. So let's get straight into it. So if you don't mind changing the slide, please, Jo.
Duck. There we go.
So in this presentation, we're going to share some info on hormones to help you better understand the role of hormones, recognize important women's hormones, manage common conditions that are affected by hormones, understand dietary strategies, provide some insight into how movement can help, and the importance of sleep. So just on the next slide, we're going to have a look at what are hormones. Hormones are your body's chemical messengers. So essentially, they tell your body what to do. And there are over 75 hormones in your body, and the balance between them all helps keep your body healthy.
That's a lot of hormones. I had no idea there were 75 hormones. Wow. Next slide.
And so then they can be broken up into a few different categories. So hormones can be broken up into the reproductive hormones, which include estrogen and progesterone and testosterone. So that's just on the next slide. Thank you. And then other hormones that also affect women's health include cortisol, parathyroid hormone, melatonin, and insulin as well.
Yeah.
All right.
I've heard of most of those. And especially, insulin, that's a really important one to know for women. So I think you're going to talk a bit more about that coming up.
Yeah, definitely. We'll get into that too.
Next page.
So then common conditions that are affected by hormones. So we're going to run through a few of them today. So the first one on the next slide is premenstrual syndrome, or PMS. So
definitely had
as
that
you can
one.
see, So as you can see, the symptoms and management are broken up into this slide. So symptoms usually occur 1 to 2 weeks before a period. And we can have both emotional and physical symptoms. So emotional symptoms can be things like irritability, anxiety, and difficulty concentrating. And then our physical symptoms can include constipation, diarrhea, swollen and tender breasts, acne, and pimples.
Wow,
And
that's
so
so interesting. I didn't actually know, that you could have digestive issues. I always knew about the breasts and the acne and the pimples, but you had never heard of that one.
Yeah,
That's
definitely.
true.
So everything's quite interconnected in the body. So it's no surprise that digestion can be affected with these hormones as well. And then so looking at the management, we've got exercise, complementary medicine and therapies, psychotherapy, hormonal medicines, and medicine as well. So they're just a few of the different approaches we can look at. So then on the next slide, we've got premenstrual dysphoric disorder. And so essentially, this is a severe form of PMS and affects up to 8% of women of reproductive age. So it's actually quite a large percent when you think about it. And so really the main kind of symptoms is it makes it hard to function at home, at work, and in relationships in the lead up to your period. So quite impacting on all areas of your life, I suppose.
So can you tell me, this is just an extreme form of PMS, is it, before a period?
So all the same symptoms, I suppose, as the last slide, but just on a more severe scale that it impacts all these different areas.
Okay, so how would I know if I potentially had PMDD over just normal PMS?
I'd be going to the doctor to get a
Mm.
diagnosis. Yeah,
Yeah. So if I'm
yeah,
concerned that it seems really quite interfering with my life, I should probably go and say, yeah, good to know. Thank you.
yeah, definitely, definitely. And if you're unsure if you've got any of these conditions, the best thing is to always chat to your GP. So we don't want to be self-diagnosing any of these. They're all things that a GP can diagnose and do the right tests and investigations for. So
Mm.
yeah, as you can see on the management here, talk to your doctor. If you have these symptoms and you think it's affecting you in this way, definitely talk to your doctor.
Yeah.
Because they can recommend like the antidepressant medication, hormone treatment, psychotherapy, lifestyle, reducing stresses, and complementary medicines and therapies as well. So they can lead you in the right direction.
Great. Good information. And sometimes you just have to try different doctors as well. If you need to go to another one that knows more about it, shop
Yeah,
around.
yeah, definitely. Find one you trust and is
Mm.
thorough with you.
Yeah.
Yeah, yeah. So the next condition that we're going to look at is polycystic ovary syndrome. So PCOS, as it's otherwise known as, increases your risk of diabetes, high blood pressure, and high cholesterol. So it's really important to get on top of
Yeah.
and try and manage as well as you can. So some of the symptoms that pop up are irregular periods, acne and excess hair growth, weight gain, issues with fertility, and anxiety and depression. So quite
Mm.
severe symptoms. So definitely, again, if you have any of these, definitely going to your GP just to get some further investigation is what I'd recommend.
Yeah, look, I've had my personal history of this, and it's something that I had no idea how impactful it could be on my health as I aged as well. So if you do have any of these symptoms, it is really important that you follow up and get some support because even an 18-year-old 16-year-old, whatever age, insulin levels in people with PCOS are so different. And, that might mean that you really need to watch your sugar levels. And you just having that link to diabetes was something that I was never told as a young person. And now having my daughter go through it, I'm really aware of it. And I'm trying to encourage other people who are younger to really take stock of that because once you get overweight and you get older, it's very hard to manage it. So what would you suggest to manage this, Paige?
Yeah, so definitely healthy lifestyle is first and foremost. So diet and exercise. Also losing weight if required. So it's really important that this is only if required, and genetics play a big role in our weight. So not being too hard on yourself.
Mm,
You have had some weight gain. And again, just focusing on those healthy lifestyle aspects rather than focusing on the weight too much, so this can become quite debilitating.
yeah,
Medical and hormonal and cosmetic treatments are also available. And again, just speaking to your GP, are probably the
yeah,
most important thing. Yeah.
that's really good. And there's all different things that different people respond to. But I know I was told when I was younger, it was, almost like that um, hunter-gatherer diet was kind of really important for me because that was something that, if I was having more protein and I was able to limit my sugars, that I would be able to manage my insulin levels. Is that something that you would also kind of promote as a dietitian? What's your thoughts
I
on that?
wouldn't, yeah, I would never recommend a specific diet.
No.
Um, One in particular, definitely just increasing whole grains, fruits, and veggies is probably key.
Mm,
Making sure we're getting adequate lean protein. Yeah, and just looking at a healthy plate model in that aspect, as little pre-packaged and as much whole foods as possible. But that's
mm,
something that if is bothering you, definitely come and see a dietitian because everyone's very different. So
yeah.
it can be about managing your own, I suppose, components of what's going on in your life as well. So I wouldn't say one thing that I'd say to everyone, but yeah, definitely just a balance of, yeah, those 5 food groups.
Good point.
Yeah.
Yeah.
Yeah. So the next one is endometriosis, or endo.
Mhm.
So this is a condition in which cells similar to those that line the uterus grow in other parts of the body, usually in the pelvis and reproductive organs. So symptoms of this can be pain and bloating. So I'm sure you can imagine, that's quite impacting on all areas of your life as well. Other symptoms are painful sex, heavy bleeding, constipation and diarrhea, tiredness, mood changes, reduced quality of life. So all
Mm,
really debilitating things that
absolutely.
people will try to cope with, but they're quite challenging to manage on your own. So following these management strategies, so pain relief medication, hormone therapy, surgery if that's what your doctor recommends, fertility treatment,
Mhm.
and talking to your doctor are all really, really vital.
Mm.
So
And
yeah,
these
definitely get on top of.
Well, these conditions you're talking about, they're just becoming so much more prevalent these days in so many ways. I'm hearing more and more people suffering, and there's a lot of people that, have suffered for quite an amount of years before they even get a diagnosis in these areas, and they don't understand what's going on for them. So I love that you've got that management there. Sometimes it is about getting that specialist intervention and having to find out what they suggest. Following up your health is just so important, and suffering in silence is just such a hard thing that
Yeah,
so many women are going through. So we just want to, raise the conversation here and open the dialogue for people to talk about what they are going through, and know that as much as it's not normal, it is a condition that can be managed. So yeah,
yeah,
thanks.
definitely. And then so if we move on, we're going to look at some strategies now. So
Mm,
how do dietary changes help? So stored body fat, which is otherwise known as adipose tissue, is actually metabolically active tissue. So
mm,
both adipose tissue and the ovaries produce estrogen. So
mm,
therefore, if you're a woman who is carrying a bit of excess body weight, the combination of estrogen produced by both the ovaries and the adipose tissue can result in an overproduction of this hormone.
yeah,
And then consequently, if a woman has chronically high estrogen levels, hormone production does become out of balance. So it's really important to consider that ratio of carbs, proteins, and fats when treating hormonal problems, which is why, yeah, as I said in the last slide, like definitely seeking that advice through a dietitian so we can tailor it specifically to you and your needs,
mm,
because everybody is so different and everybody is able to
so
tolerate
true.
different foods. Yeah, so it's something that really has to be a very individualized approach.
Yeah, I love that you
Yeah.
mentioned that, because that's something, again, I didn't really do. I more went like, oh, this is a fad thing, I'll try that, and tried to manage it all on my own. And in retrospect, I probably did a lot of damage. So I do agree with you, get that individualized, tailored support, and try not to go on it alone, because there's people that know a lot more
Mm,
the way it all interacts. And I guess it's a complex thing to know. So the internet's not always the best place to try and find out how to support yourself. Going to somebody who's actually well trained is my recommendation. And gosh, I want to eat that nutritious bowl of food you've got there. That looks beautiful.
mm. Yeah, and
Thank
I
you.
think it's very hard now because everything is so accessible via the internet. So you can get advice, any advice that you are searching for, you can find.
Hmm.
And whether it's actually like peer reviewed, evidence-based practice is a whole nother thing. So we don't want to be going on any fad diets or starting anything that someone's recommended over the internet or over socials. We
Yeah.
want to be getting information that is credible and that we know is actually going to work, and also protect you in the long term and set you up for a healthy lifestyle. I think one of the biggest traps people get into is doing fast fad diets, but they're not something you can sustain forever. And so we
Mm.
really do focus as dietitians on something that you can do for a long time, for the rest of your life, and nourish your body.
Oh, so well said. And look, one of the barriers for me was always I thought that you would, cost a fortune to see a dietitian, and that was just for the rich people, not for me who was okay and I was doing all right. But the reality is that you can see community dietitians quite affordably. So I know, do you have any words to comment on that one, Paige?
Yeah, definitely. Like, and you can even self-refer. So here at Colac Area Health, you can call reception, and they can pop in a referral for you or set you up with how you can pop in a referral. So you might go on a wait list, but it's not usually too long. But definitely just searching for that help or going to your GP and they can refer on as well. So we're very available. There's 3 of us here at Colac. I can only speak on behalf of Colac.
Well, that's a good
Um,
number though.
yeah. So, and we see a whole variety of conditions. So we're always happy to help.
Yeah, and Hesse Health in Winchelsea has a dietitian, also Bannockburn, and I know the Great Ocean Road Health team have a great dietitian down in Apollo Bay and Lawn. So yeah, there's tends to get onto your community health team and follow up and make an appointment.
Definitely. So on the next slide, I'm going to go into some more dietary changes that you can make, or quite easy changes. So eating foods from the 5 food groups each day. So the 5 food groups are vegetables, fruits, protein, whole grains, and dairy products. And then within those food groups, yeah, just looking for like those really lean sources of protein. So chicken, eggs, tofu, legumes, nuts and seeds, red meat, but making sure it's really well trimmed and only had occasionally, and tuna and seafood and all of those beautiful sauces as well. Then we
Look at
also
the
want to
color
choose.
you've got there. It's like a rainbow. So
It is a rainbow, absolutely.
yeah,
So
so
we want to choose whole grains over highly processed grains. So rice, quinoa, bread, um, pasta, any of those are good sources of whole grains.
and there's some
Eating
great
regular
pastas
food.
out there with pulses in them nowadays.
There are, yeah, yeah,
Yeah.
yeah. So pulses, so including like lentils and
I couldn't
those
believe
sorts
you
of
could
things
have
as well.
lentil and chickpea pasta. So,
Yeah,
and it my kids eat it. They don't even notice the difference. So
yeah.
it's
Great way of getting some more fiber in,
mm,
hiding some of those veggies too to get some more diversity.
mm,
Um, and we also want to be eating regular meals and snacks when you feel hungry. So breakfast, lunch, and dinner. So many people do not eat breakfast and it does not set you up for a day. Usually you'll be peckish in the afternoon or overeat later in the day. So we want
mm.
breakfast, lunch, and dinner every day and nourishing snacks between as you feel hungry.
Yeah, there's
We don't
another
want to
myth,
be,
isn't there, about just skipping
yeah,
breakfast. People think that that's going to set them up, but in terms of hormones, I can imagine that wouldn't really keep your hormones on that level balanced playing field.
no. And it can just mean your hunger hormones skyrocket. While you try to suppress them, they skyrocket. So yeah, we want to be nourishing our body, not depriving it.
Yeah.
Yeah. And so we want to include healthy fats as well, and brightly colored fruits and vegetables, to get variety into our diet and help
Mm.
with our digestive health as well.
Perfect.
So the next one we're going to get into is moving more. So we want to build physical activity into your life to try to do at least 30 minutes of exercise every day and try different activities to find ones you enjoy. So there's no point doing an activity you don't enjoy. Don't force yourself to run if you're not a runner. If you're happy doing yoga or playing golf or going for a swim, there's so many different forms of activity. It's just about moving your body and finding the one that you enjoy. Because if you find one you enjoy, you can do it for a long time. But if you find
Mm.
one that's punishment, you're not going to stick to it. So
That's
the
definitely
best
my lesson
activity for
learned.
you.
Yeah.
Find the
A friend
activity
was
for
saying
you.
they do yoga like a sloth in their pajamas in front of the
Yeah.
TV, but they were able to sustain that because they weren't trying to go to the gym and dress up and feel they liked to be a sloth, you know. So that was an interesting
Yeah,
comment. So exercise the way you feel best.
absolutely.
Love it.
Absolutely.
Great message, Paige. Thank you.
And then our last little tip is trying to sleep well. So to do this, we want to reduce caffeine intake. So particularly later in the day, try and have, if you're going to have caffeine, have it earlier in the day. Avoid heavy late meals at night so that you've got some time, your food's digested before you pop your head on the pillow. Limit alcohol consumption. Be physically active so your body is actually quite tired and ready to go to sleep. Go to bed and wake up at regular times. So set up a bit of a routine so your body can get into that and get used to it. Also hiding the clock so you're not waking up during the night and checking the time, checking how long you've been awake, because that's just going to extend those periods where you're awake during the night.
Yeah, it's a
And there's
trap.
also, it is a trap, absolutely, and especially with most of our phones beside our beds.
Absolutely.
If you can put in a separate room and have an alarm clock that's hidden, so your alarm still goes off, but you can't see the time, that can be a good technique. But certainly just finding what works for you again.
Because if I see
And
it's
try.
4 a.m. and I know I've got to get up at 5, I don't want to go, I can't go back to sleep.
Yeah, exactly, exactly. If you know you've only got a short time left to sleep, you might just get up.
Mm.
So allowing your body that time to rest and recover. It's also really important for keeping all of our hunger cues in check as well, because we want to get adequate sleep so our body can rest and then restart the cycle. So it's important in so many areas.
And for
And again,
hormones.
yeah, hormones as well. Yeah.
Mm.
And so we want to try relaxation.
Yeah.
Just try and relax. So seeing a doctor for a health check. So a health check is a medical examination by a health professional. We have regular general health checks with your doctor to check on your current health, find health issues early, have age-specific screening tests, and learn about your health. So just asking your doctor if you need any other tests and how often you should have them is really important. So keeping that communication open with your GP so they can understand you and guide you accordingly.
Especially important when I hear how interrelated all these health conditions are. So obviously, you know, with
Absolutely.
all of the conditions, they can affect things like your heart, your other areas of your health as well. So checking it all out is so important.
Definitely, definitely. And so here's just some more details for if you want to get in contact or if you want to get any more information or book an appointment, you can go through here as